So next is pulse taking. So definition, expansion of the arterial walls occurring with each ventricular contraction. So the purpose is to provide clinical data regarding the heart's pumping action and the adequacy of peripheral artery blood flow. So our equipment is watch with the second hand. So the first procedure is to identify the client and explain procedure. So rationale is to ensure right procedure to the right patient and to alleviate fear and anxiety, thus promoting cooperation. So hi ma'am, I'm Al-sodaire Mangatong. So I'm your nurse for today. So how are you ma'am? Okay. So next procedure is assess client's condition, check nature of pulse. So rationale is to serve as baseline data. So ma'am, let me check po. Check po lang po natin yung pulse niyo. Next is assemble equipment. So to save time and effort. So, watch with the second hand. So the next procedure is wash hands to wash hands to reduce transfer of microorganisms. So the next procedure is have the patient rest his arm alongside of his body with the wrist extended and the palm of the hand downward. So the rationale is, so this position places the radial artery on the inner aspect of the patient. So side. So guys, nakita natin. So next procedure, place the tips of your middle 3 fingers on the palm side of the patient wrist. So to rest thumb on the back of the patient wrist. So the rationale, fingertips are sensitive to touch and will feel the pulsation of the patient's artery. So the thumb should not be used because it has pulse to avoid confusion. So here, fingers. So next is apply enough pressure so that you can feel the pulse, not too hard, not too light. So pressing too hard may stop flow of the blood and you will not be able to feel the pulse. So too little pressure will be imperceptible. So, ma'am, check po natin ulit yan. So, kita. So using a watch with the second hand. So using a watch with the second hand, count the number of pulsation felt on the patient 1 full minute. So enough time is necessary to detect irregularities and abnormalities. So if the pulse rate is abnormal, repeat the procedure. So to determine accurately its rate, quality, and rhythm. So number 10 is wash hands for infection control measures. So the next is evaluate nature of pulse to identify if the client has normal or abnormal pulse in terms of rate, rhythm, and quality. So record the pulse, record the pulse rate, rhythm, and force immediately in the graphing sheet. So to serve as baseline data for healthcare provider. So that's all. Thank you.